Today, there are over 1 million Americans living with or in remission from blood cancer. Here to discuss breakthroughs and treatment options is Dr. Luis DeGennaro, President and CEO of the world's largest blood cancer nonprofit organization, and also world-renowned cancer researcher, Dr. Gail Robos. Good morning. Great to have you both on The Blend this morning.
Good morning.
Good morning, Stephanie.
Dr. DeGennaro, what is the ASCO annual meeting, and kind of explain what happens there?
Of course, Stephanie, ASCO, or ASCO as we call it, is the annual meeting of the American Society of Clinical Oncology. This is an opportunity for thousands of researchers who study cancer and physicians who treat cancer patients to come together and review the latest data from clinical trials, testing new and existing cancer agents. Many of these late-stage tests provide the data that will allow physicians to move forward in clinical practice with new treatment modalities for patients with cancers, and especially the blood cancers in our case.
And Dr. Robos, as far as advances, what are you seeing on the horizon?
Well, we're hoping that this meeting is going to be exciting for a couple of reasons. You're going to hear about new ways to give older chemotherapies. You're going to hear about immunotherapy, ways to use the immune system to fight back cancer, and also targeted treatments, so trying to hit specific genetic mutations that may be present in an individual's particular type of cancer.
And as far as the blood cancer therapies, how do they actually help patients with blood cancer?
So the idea is with blood cancers to put people into remission. So for example, in acute leukemia, this is a problem of the bone marrow. The bone marrow needs to work for somebody to stay alive, and you need to make white blood cells, red blood cells, and platelets. So the idea is to get rid of leukemic cells to allow the bone marrow to have normal regrowth of the normal blood-forming cells that you need to stay alive. And there are different ways to do this with drugs and with stem cell transplantation, and sometimes with combinations of the two.
Dr. DeGennaro.
Stephanie, go ahead, Stephanie.
Oh, please continue.
Well, so one of the exciting things about the blood cancers is that research in the blood cancer space tends to be the pioneer, the place that new advances get made the fastest, and then those advances percolate out and spill out into treatment for other cancers and other diseases. Immunotherapy, one form of immunotherapy, for example, CAR T therapy, was pioneered in the blood cancers, but now it's being tested in breast cancer, colon cancer, prostate cancer, many other cancers. So there's a great opportunity there to move things forward in the blood cancers, but then pay benefit to many other cancer patients as well.
Well, if there is any light in the whole cancer talk, at least there are advancements and there are options. Where can people turn to for support?
Blood cancer patients in particular should turn to the Leukemia and Lymphoma Society website, LLS.org. And they'll find the best information there. We also have a phone number that patients and caregivers can call. It's 800-955-4572.
Thank you both so much. It was a pleasure having you on the show. And if you'd like to learn more about this segment or their website, head to our website, fox4morningblend.com. We'll have it all for you right there. Coming up next, how Maid Pro can help take the work out of housework. Why you should call the maids in with the muscle to help carry your load.